Good morning, students. Today's topic is diabetes mellitus. Diabetes mellitus is a metabolic disease due to absolute or relative insulin deficiency or due to resistance to the actions of insulin. It is a common clinical condition. About 10% of the total population and 20% of the persons above age of 50 are suffering from this disease. It is a major cause of morbidity and mortality. Morbidity means illness, mortality means death. In diabetes mellitus, due to deficiency of insulin, the blood glucose level is increased. In spite of high blood glucose level, the entry of glucose into the cell is inefficient due to lack of insulin. Hence, the cells are starved of glucose, or cells will not get glucose. So first we will see types of diabetes mellitus. First is type 1 diabetes mellitus. It is also called as insulin dependent diabetes mellitus, IDDM. About 5% of total population of diabetics patient are suffering from this type 1 diabetes mellitus. Here you can find less insulin or absolute insulin deficiency in these patients. Second is type 2 diabetes mellitus, also called as non-insulin dependent diabetes mellitus or NIDDM. Majority of the patient belong to this group. Here you can see circulating insulin may be normal or mildly elevated or slightly decreased depending upon the stage of disease. The main defect in this type of diabetes mellitus is resistance to the action of insulin. Apart from these two types, in small amount of cases, secondary diabetes is also seen. Secondary diabetes means when the cause of diabetes mellitus is known, then that is called as secondary diabetes mellitus. The secondary diabetes mellitus may be due to endocrinopathies, that is disease of endocrine glands like Cushing's disease, thyrotoxicosis, disease of thyroid gland, acromegaly, or secondary diabetes mellitus may be secondary to drugs like steroids, beta blockers, which increases the blood glucose level. Sometimes this secondary diabetes may be due to disease of pancreas, and these pancreatic diseases are chronic pancreatitis, fibrocalculous pancreatitis, hemochromatosis, which is seen when iron is deposited in the pancreas and damage the pancreas, cystic fibrosis. So these are the some causes of secondary diabetes mellitus. Diabetic prone state means those persons who have chances of development of diabetes mellitus in the future, and these diabetic prone states are gestational diabetes mellitus, that means increase blood glucose level in pregnancy. Then impaired glucose tolerance test. Impaired glucose tolerance test means when we measure the fasting and post meal blood glucose level of a person, and if that blood glucose level does not falls in normal range or not in diabetic range, then such persons are called as impaired glucose tolerance. Next is impaired fasting glycemia. Sometimes only fasting blood glucose is measured, and if that fasting blood glucose level does not falls in normal range or in diabetic range, then such persons are also called as impaired fasting glycemia. So these three states are called as pre-diabetic states. These patients have not yet developed diabetes, but they are prone to develop diabetes in the future if precautions are not taken. If the precautions are taken at this stage, the patient may become normal. So we will see about type 1 diabetes mellitus. As I have told you, it is due to decreased insulin production by pancreas. These patients are dependent on insulin injection, therefore it is also called as insulin dependent diabetes mellitus. It is generally seen in patients below 30 years of age. Here ketosis is very common in this patient. What is ketosis? We will see later on. The most common cause of type 1 diabetes is autoimmune basis. Type 2 diabetes mellitus, the most common diabetes mellitus. 95% of the patient of diabetes mellitus are suffering from this type. Here the patient shows resistance to the action of insulin. That means insulin will not able to perform its function. It is generally seen above 40 years of age. Ketosis is not generally seen, but if the blood glucose level is very high, then ketosis may develop. And 60% of this patient shows obesity. Therefore, we can say that obese persons have more chances of developing diabetes mellitus. It is an association. Now next we will see metabolic derangements or irregularities in diabetes mellitus. First we will see in carbohydrate metabolism. Due to insulin deficiency, decrease uptake of glucose by the cells. All of us know that insulin is required for the transport of glucose from blood to cell, particularly in adipose tissues, skeletal muscles. As insulin is deficient, the glucose will not enter in the cell. But there are some cells where insulin is not required for the transport of glucose, like central nervous system, kidney, liver, where glucose enters inside the cell without help of insulin. But as the skeletal muscle forms large part of the body, due to deficiency of insulin, glucose does not enter into the skeletal muscle. The blood glucose level will increase, leading to diabetes mellitus. Secondly, in this case, due to deficiency of insulin, the enzymes which are insulin dependent becomes less active. Therefore, there is inhibition of glucose utilizing pathways like glycolysis, glycogenesis, HMP shunt pathway, uronic acid pathway, etc. At the same time, there is stimulation of glucose synthesizing pathways like gluconeogenesis, glycogenolysis, etc. The net effect of this is increase in the blood glucose level, leading to hyperglycemia. So these are the irregularities seen in carbohydrate metabolism. Now we will study the derangements or irregularities in lipid metabolism. In diabetes mellitus, there is increased breakdown of triglycerides in adipose tissues. The enzyme which require for breakdown of triglycerides in adipose tissue is hormone sensitive lipase. Now this hormone sensitive lipase is normally inhibited by insulin. Due to deficiency of insulin in diabetes mellitus, the hormone sensitive lipase becomes more active and it breaks the triglyceride which are stored in the adipose tissue and enters into the circulation. All these triglycerides and fatty acids, then enter into the blood, leading to high free fatty acid level of plasma. They goes to the liver and get deposited in the liver, leading to fatty liver. Normally, the enzymes of beta oxidation pathway, that is the pathway which is responsible for breakdown of fatty acids. So these enzymes of beta oxidation pathway are inhibited by insulin. But due to deficiency of insulin, again these pathway get stimulated. At the same time, due to deficiency of glucose inside the cell, there is deficiency of energy to the cell. So both these reasons lead to breakdown of fatty acid in the liver. When these fatty acids are broken down in the liver, the end product is acetyl-CoA. So acetyl-CoA is increased, and when this acetyl-CoA level increases, that acetyl-CoA is used for synthesis of ketone bodies, leading to ketosis. These acetyl-CoA are also used for synthesis of cholesterol, which get deposited into the blood vessel when its level increases, leading to atherosclerosis. So these are the derangements seen in lipid metabolism. Now come to the protein metabolism. Insulin is anabolic hormone. It stimulates protein synthesis. Again, due to deficiency of insulin, there is increased breakdown of proteins to amino acid, and these amino acids are used for synthesis of gluconeogenesis. Therefore, there is loss of muscle protein, leading to muscle wasting. So this is about the derangement seen in diabetes mellitus. Now we will see the symptoms of diabetes mellitus. Cardinal symptoms means the main symptoms in diabetes mellitus are denoted by 3 P's, and these 3 P's are polyuria, means more diuresis, polydipsia, means increased thirst, polyphagia, that means patient will take more food. So these are the 3 cardinal symptoms of diabetes mellitus. The other symptoms are weight loss. Though patient is taking more food, the patient will have loss of weight because the glucose is lost into the urine. Secondly, as the blood glucose level increases, it gives favorable environment for the growth of bacteria. So such patients have chronic recurrent infections. Now we will see the complications of diabetes mellitus. Generally, 2 types of complications: acute complications and chronic complications. So acute metabolic complications means which are seen suddenly. So these are diabetic ketoacidosis. Second is hyperosmolar non-ketotic coma. Non-ketotic coma means in this case patient goes in coma but ketone bodies are not seen. In first case, that is diabetic ketoacidosis, patient goes in coma. In both the cases the patient goes in coma. In the first case ketone bodies are detected, and in the second case the ketone bodies are not detected. So this hyperosmolar non-ketotic coma is generally seen when the blood glucose level is very high, that is up to 900 milligram %. Next complication is lactic acidosis, that is accumulation of lactic acid in the muscles. Then another complication is hypoglycemia. So these are the acute complications of diabetes mellitus. We will see one by one in detail. First is diabetic ketoacidosis. This diabetic ketoacidosis is generally seen in type 1 diabetes mellitus. Normally, ketone bodies in the blood is less than 1 milligram per deciliter. But in diabetes patient, the ketone bodies in the blood increases. When the ketone bodies in the blood increases, it is called as ketonemia. Ketone bodies are easily filtered through the glomerulus and get excreted into the urine. When ketone bodies are excreted into the urine, that condition is called as ketonuria. Acetone is a ketone body which is volatile at body temperature. So this acetone becomes volatile and get expelled along with the breath outside, and this has fruity smell. So the patient have fruity odor breath. Now when these three conditions combines, that is ketonemia, increase in the ketone bodies of blood, ketonuria, increase in the ketone body excretion in the urine, and fruity odor in the breath, these three combines, when these three conditions combines, it is called as ketosis. So ketosis is more commonly seen in type 1 diabetes mellitus. It is also seen in type 2 diabetes mellitus when it becomes uncontrolled or when the blood glucose level is very high. Now how will you manage this diabetic ketoacidosis? As it is seen in type 1 diabetes mellitus or when the blood glucose level is very high in type 2 diabetes mellitus, the administration of insulin is very, very important along with glucose. Then bicarbonate should be given to treat the acidosis. Why there is acidosis in diabetic ketoacidosis? Because the ketone bodies are acidic in nature. So the H plus ion concentration in the body get increased, leading to fall in pH, causing acidosis. To counter that acidosis, bicarbonate should be given. As there is polyuria, loss of water from the urine, which is corrected by giving normal saline. Then electrolyte balance also should be corrected, mainly hypokalemia, that is decreased potassium levels, by giving intravenous electrolytes. Then treatment of the main cause, that is infection, should be given. So this is about the diabetic ketoacidosis. Next is hyperosmolar non-ketotic coma. Here blood glucose level may be high up to 900 milligram per deciliter or more than that. As the blood glucose level increases, the osmolarity of the extracellular fluid also increases. But inside the cell there is no glucose. Therefore, there is osmosis of water from intracellular compartment to extracellular compartment, leading to dehydration of cells. Also, diuresis means more urine leads to loss of water and electrolyte from the body. When there is dehydration of cerebral cells, it will lead to coma in this case. Lactic acidosis is seen when there is overproduction of lactic acid or underutilization of lactic acid. In diabetes mellitus, the patients are treated with oral hypoglycemic drugs, and one of the group of oral hypoglycemic drug is bigonides. These bigonides leads to lactic acid production in the muscles. Therefore, lactic acid get accumulate in the body, leading to lactic acidosis. Now this inhibit TCA cycle and gluconeogenesis. These bigonides inhibit the TCA cycle and gluconeogenesis. Therefore, pyruvate is converted into more and more lactate, leading to lactic acidosis. Another complication of diabetes mellitus is hypoglycemia. How it happens? Hypoglycemia is very fatal condition. Hypoglycemia means when the blood glucose level decreases below 50 milligram per deciliter. In some books it is given as 40 milligram per deciliter. It is a life-threatening condition. And why there is hypoglycemia? The hypoglycemia in diabetes mellitus is only because of overdose of either insulin or oral hypoglycemic drugs. Now, after completing the acute complications of diabetes mellitus, we will see chronic complications of diabetes mellitus. And the chronic complications are vascular diseases, complications of eyes, neuropathy, Kimmel-Still-Wilson syndrome, and pregnancy related complications. We will study one by one. First is vascular disease. Two types of blood vessels are affected in diabetes mellitus: medium size and small size, that is capillaries. The medium size blood vessels undergoes atherosclerosis, that is deposition of fat and other products into the intima of medium sized blood vessel, leading to blockage of that blood vessel, that is called as atherosclerosis. Sclerosis means hardening. Then another complication which is seen in medium sized blood vessel is thrombosis. Thrombosis is a insoluble clot formed by aggregation of platelets, and it may also block the blood vessels. So these two, atherosclerosis and thrombosis, causes decreased blood flow through the blood vessel. If we come to the small vessels like capillaries, then in the capillary endothelial cell and its basement membrane get damaged, and it is called as microangiopathy. The blood vessels or capillaries which shows microangiopathy are found mainly in retina, leading to retinopathy, in kidney causing nephropathy, and in neuron leading to neuropathy. So the capillaries mainly present in retina, kidney and neuron shows microangiopathy, and it is a irreversible condition. When this diabetic retinopathy, diabetic nephropathy and diabetic neuropathy occurs, it is an irreversible condition and it will damage the retina, kidney and neurons permanently. Next chronic complication is complications seen in eye. The two types of complications are seen. One is cataract, another is retinopathy. When the blood glucose level is increased, then more glucose enters inside the lens, because the transfer of glucose from blood to lens does not require insulin. As the more glucose enter inside the lens, which is not utilized by the lens, then that glucose is reduced to an alcohol called as sorbitol. Once this sorbitol is formed inside the lens, this sorbitol have osmotic effects. That means it absorbs water from the surrounding tissue. So water get accumulated in the lens and finally that lens becomes opaque, which is called as cataract. The another complication is retinopathy. Just now we have studied small vessels or small capillaries of retina shows microangiopathy. That means damage to the endothelial cell and basement membrane of capillary occurs. This leads to retinopathy, and once this retinopathy occurs, the patient becomes blind. It is also a irreversible condition and it is the most common cause of permanent blindness due to diabetes mellitus. Another complication, neuropathy. When the small capillaries of neuron get damaged, and also neuronal proteins undergoes glycation due to high blood glucose. Glycation means when glucose combines with a protein, it is called as glycation or glycosylation. When protein combines with glucose or sugar, this protein becomes functionless. When the blood glucose level is low, less glucose combined with the protein and less protein get damaged in normal person. So when blood glucose level is high, then more glucose level enter into the neuron, because neuron does not require insulin to transport glucose from blood to neuron. So more glucose enter inside the neuron, binds with the more neuronal protein, leading to glycation of that protein. When this protein get glycated, they become functionless. So such person will have peripheral neuropathy, paresthesia. Paresthesia means altered sensation. Also, high blood glucose level when enters into the Schwann cells and get converted into sorbitol, it also causes osmotic effects, leading to damage to the Schwann cells, which finally leads to neuropathy. When the patient suffer from neuropathy, they lose sensations, generally of foot. When they lost sensations of foot, they does not able to detect the injury to the foot, or they will not able to detect the pointed object below their foot. Therefore, they kept their foot on that pointed object, as they does not get any sensation, which damage their foot, leading to foot ulcers. If these foot ulcers are not treated properly, it may lead to gangrene. Hence, care of feet in diabetic patient is very important. Advanced glycation end product means when this blood glucose enters inside the neuron, combines with the neuronal protein, it forms a glycation product which is called as advanced glycation end products. Next complication is Kimmel-Still-Wilson syndrome. Here you will see nephrosclerosis. Nephron becomes hard, get damaged. Therefore, they are characterized by proteinuria, loss of protein in the urine. There is glycation of the basement membrane protein, means glucose get bind to the proteins present in the basement membrane of glomerulus. Ultimately, the patient goes in renal failure. In pregnancy, the diabetic mother give birth to big babies more than 4 kg weight. This is because insulin is an anabolic hormone. When the insulin level increases in the mother, this insulin enters into the fetal circulation and stimulate anabolism. Another cause is high blood glucose level in the maternal blood gives more and more blood glucose to the baby, which causes increase in weight of the baby. Second complication is chances of abortion increases, premature birth, and sometimes death of fetus is also seen in the uterus. So these are the chronic complications of diabetes mellitus. Now we will see laboratory investigation in diabetes mellitus or diagnosis of diabetes mellitus in laboratory. We have to check blood glucose level, fasting blood glucose level and post meal blood glucose level. So what is meant by fasting? When the person have not taken any meal for last 10 to 12 hours, then it is called as fasting blood glucose level. It is generally done in the morning. Post meal blood glucose means measurement of blood glucose level after 2 hours of meal. So these are the results of blood glucose level. If the fasting blood glucose level is less than 110 milligram per deciliter, then we can say that person has normal But if blood glucose level increases above 126 milligram per deciliter, then we can diagnose that patient as diabetic. If the fasting blood glucose level falls between 110 and 126 milligram per deciliter, then we can call this patient as impaired glucose tolerance. So such patients are in a state of pre-diabetic state. They may develop diabetes if precautions are not taken. Similarly, the results of blood glucose in post-meal state are: in normal person it is less than 140 milligram per deciliter, and in diabetic person it should be more than 200 milligram percent or per deciliter. If the blood glucose level falls between 140 to 200 milligram per deciliter, then you can say the patient is in pre-diabetic state, that is impaired glucose tolerance. In India, we will measure blood glucose in milligram per deciliter, but in Western countries, they will measure the blood glucose in milliosmol per liter. So readings of this milliosmol per liter is shown here. Another diagnosis is complete lipid profile. Complete lipid profile means you have to perform these 5 tests: serum total cholesterol, serum triglycerides, serum HDL cholesterol. HDL means high density lipoprotein. Then serum LDL cholesterol and serum VLDL cholesterol. So these 5 tests comes under complete lipid profile. In diabetic patient, the lipid profile is also deranged because there is irregularities in lipid metabolism. Then to detect the kidney function, we have to perform kidney function test like blood urea and serum creatinine. These level may increase. Next is microalbuminuria. Here we are detecting presence of albumin in urine of the patient to detect microalbuminuria. Microalbuminuria is a initial stage where protein starts excreting into the urine. Initially it is excreted in less quantity, that is below 300 milligram per day. Therefore it is called as microalbuminuria. It is a predictor of renal damage. That means if microalbuminuria is seen, then we can predict that the patient may develop renal damage in the future. So if we take precautions after detecting microalbuminuria, we can save the kidney of the diabetic patients. Next test is urine glucose and urine ketone bodies. All of you know urine glucose is detected by Benedict test and urine ketone bodies are detected by Rothras test. Normally individuals shows Benedict test and Rothras test negative, but diabetic patients may show Benedict test and Rothras test positive. Renal threshold is for glucose is 180 milligram per deciliter. What does it mean? It means that when the blood glucose level increases above 180 milligram per deciliter, then glucose appears in the urine. And the last laboratory investigation is glycated hemoglobin. As I have told you, when glucose combines with proteins and form glycation products, hemoglobin is also a protein in the blood. So when the blood glucose level is high, then more glucose combines with hemoglobin and forms glycated hemoglobin. So if we measure glycated hemoglobin and its value is high, then we can conclude the long-term control of blood glucose level. Glycated hemoglobin means addition of glucose to the hemoglobin without help of enzyme. Once this glycated hemoglobin form, it will remain in the blood for long period of time. Therefore, it gives long-term control of glucose, blood glucose level. Now, how will you manage the patient of diabetes mellitus? First is diet and exercise. It is the first line of treatment. Exercise should be done. Balanced diet should be taken, which contains high protein, low carbohydrate or calorie, and devoid of refined sugar. Refined sugar means monosaccharide, disaccharides. Low saturated fat. Saturated fat generally comes from animal food. Adequate polyunsaturated fatty acids. These polyunsaturated fatty acids are present in vegetable oils. Low cholesterol. Generally, cholesterol is seen in milk and milk products. Sufficient quantity of fiber should be taken, and vegetables should be taken. Secondly, oral hypoglycemic drugs. It is generally used in type 2 diabetic patients. There are two groups of oral hypoglycemic drugs: sulfonylurea group and biguanides group. This hypoglycemic drug acts on pancreas, stimulate the pancreas to secrete more insulin. At the same time, they also decreases the insulin resistance. Third treatment is insulin injection. It is generally given to the patient of type 1 diabetes mellitus because they have clear-cut insulin deficiency. Insulin injections are also given to type 2 diabetic person when oral drugs are not sufficient. And the fourth management is prevention of complications of diabetes mellitus. So this is about the diabetes mellitus. Now various cases will be asked on this topic. One of these cases is a 53-year-old man is admitted in semi-comatic condition. His fasting blood glucose level is 410 mg per deciliter. Urine sugar is 3+, and ketone bodies are found in the urine. Name the clinical condition. Here, as the blood glucose level is high and also you are getting glucose in the urine, you can say it is a case of diabetes mellitus. The another question is, explain the underlying cause. The underlying cause may be insulin deficiency in type 1 diabetes mellitus, or it may be resistance to the action of insulin in case of type 2 diabetes mellitus, or there may be secondary causes like increase in thyroid hormone, thyrotoxicosis, increase in growth hormone in acromegaly, or increase in corticosteroid hormone in Cushing syndrome, or there may be damage to the pancreas. So these are the various causes leading to increased blood glucose level. Next question is, what is renal threshold? Normal renal threshold is 180 mg per deciliter. What does it means? It means that when the blood glucose level increases above 180 mg per deciliter, then glucose start appearing in the urine, because more glucose in the blood leads to more filtration of glucose in the urine. The next question is, which test detects urine glucose and urine ketone bodies? For urinary glucose you will do Benedict test, and for urinary ketone bodies you will do Rothras test. So this is about the diabetes mellitus. It is a very important disease. Thank you very much.